Doctor, I think I have breast sagging. Now what do I do? Very common question. So many patients ask us about it. So let's analyze this situation. Many times, these ladies have had deliveries, done breastfeeding, and they tell us they have breast sagging. They actually don't. What they have is loss of volume depletion of the breast, which makes the breast appear to have sagged. How do we know that there is actual sagging or not? Let us see this. Now, if you look at this, suppose a breast is placed like this. The nipple, which is the center of the breast, is here. This is the inframammary fold. If the nipple is above the inframammary fold, it is not sagging, it is deflation. If the nipple is at the inframammary fold, that means it is looking like this downwards, then it is grade 1 of sagging, also called as ptosis, PTOSIS. It's a difficult to pronounce word. This amount of sagging can easily be corrected using ultra high profile silicone implants. Or we can also do a nipple lift kind of a procedure that is easily done. If the nipple is more downwards compared to the inframammary fold, then grade 2 and grade 3 sagging happens, and that requires breast implant along with breast lift surgery. A common mistake that is done by many patients as well as their plastic surgeons is they don't do a breast lift and only put an implant into the sagging breast. Now, what happens? Think of a socks and you put a rock into it. Will the socks go down or will it go up? Obviously, it will go down. And therefore, if you put an implant into a sagging breast, the breast will only sag further and not move upwards. So, to take care of breast sagging, you have to do a breast lift with implant. To take care of volume loss, you only need to do breast implants. How do we actually treat actual breast sagging when a patient comes to us? So, what is breast sagging? As I've defined in my previous question, what is breast sagging? So, breast sagging is defined when the nipple of the breast is below the inframammary fold. So, we do a customized procedure specially designed for you called the dual plane breast lift implant surgery. We first do a dual plane breast implant, then shape the breast around it. We create a lift, and the entire breast is centered around the implant, giving a nice perky look. In fact, you don't even need to wear a bra to support that breast. The breast just stands up like this. We also do a procedure called internal bra sometimes to support the breast implant. We use a mesh or a net to give additional support to the breast if the breast tissue is weak, because this allows, like an internal bra, a bra to support the implant, and that is only done if the tissues are weak and gives much better support to the breast. We should always choose an implant which is not very big. Big implants in breast sagging can cause further sagging, and we do not recommend them. In fact, they don't cause a good aesthetic look as well. So, in summary, the treatment for breast sagging is either a breast lift if the volume is good enough, or if the volume is not good enough, then we do a breast dual plane breast implant surgery along with breast lift.